For all its faults, it is Whitehall, the seat of English government for a millennium that nearly every business, every hospital, every care home in England has looked to for answers in these grim days.
Right from the start, it's been clear that this horrible virus affects older people most. So right from the start, we've tried to throw a protective ring around our care homes.
Sometimes they've been good, sometimes deeply wanting, and it feels, perhaps too often, what's been promised has simply never quite materialised. It is perhaps the care sector which has felt this void most acutely, and nowhere more than in testing.
We have now managed successfully to deliver tests to every care home that is eligible, both for staff testing and for residents to be tested for every...
Anyone in a care home across Britain watching this programme has been tested, or they're deluded.
Or the tests have been delivered.
This was later disputed by some, but government went further, going on to promise routine testing beginning on July the 6th, taking in the whole sector through August. At the time, Matt Hancock said that over the following 4 weeks, retesting will have been rolled out to all care homes for over 65s and those with dementia who have registered to receive retesting. Repeat testing will be extended to include all care homes for working age adults in August. But so far, that hasn't happened. To control this horrendous epidemic in social care, the best shot we have, short of a vaccine, is probably systematic, regular testing. Because carers can often visit multiple homes in a day, they can often be asymptomatic, and residents can often fail to identify and communicate their symptoms. So there is no setting where regular testing could be more important. Indeed, this is something that ministers recognise and promised a rollout of regular testing in the sector over the summer. Weekly for staff and monthly for residents. The problem is, as we've learned, that rollout in some places is patchy, it's bureaucratic, and sometimes completely non-existent. Newsnight has exclusively seen polling data which lays bare the problem. Almost a fifth of staff in care homes say they've had no tests whatsoever. Of those who have been tested, almost half have only been tested once, and a quarter only twice. This for the entire pandemic. Regular routine testing seems barely to have got off the ground. Despite government saying they have excess capacity, we've also been told about care homes routinely trying to register for tests only to be greeted with an automatic reply that demand is too high and that they cannot be made available at this time. Care home owners feel deeply frustrated.
Access to the government portal has been difficult at times, certainly with the reordering, when they're waiting for you to be practically out of stock. So delivery takes 2 or 3, sometimes 3 weeks.
But their frustration is nothing to compare with that of staff themselves, directed at government and sometimes their employers. We've spoken to several carers in the last few days who, cognizant of the high death toll for care workers, remain very fearful. One of them has agreed to speak to us on camera, provided that we don't show her face.
We have had no testing. We did have, I think, someone from the local council, a doctor, who came in and spoke to the carers about the COVID tests. That was, I think, around at the end of May. Said that we would be tested within the next couple of weeks. Someone would come in and do the tests. Then we would be tested every week after that, and I think the clients were every month. Nothing's happened. No one's been tested. We don't even have our temperature taken when we go in the morning.
Really?
Yes, never.
I mean, that seems extraordinary when you consider so many employers across the country are just doing that, who don't work with vulnerable people, are doing that just as a matter of course.
Well, yeah, but no, we don't even have that.
Things seem unlikely to get better immediately. It was reported at the weekend that government has pushed the rollout back into September, with contact tracing also coming up short. It augurs badly for what is to come. Let's remember why this matters. In some weeks of this year, deaths in care homes were nearly 300% above normal. And the scary thing is that this is supposed to be the easy bit. In spring and especially summer, Whitehall has every advantage. As autumn gives way to winter, those advantages will disappear. And there are some in the social care sector who fear that this crucial time is being lost.
just thinking about what winter will be like, not just with COVID-19, but with all the other infections that come, with all the other illnesses that can ravage care homes and the care sector. Winter just seems like an absolute nightmare, and we're already getting reports from UNISON members about how worried they are about what will happen in the future, and it's making some of them think twice about staying in the care sector.
There's no doubt that ministers have dramatically expanded testing capacity. But in social care, a test 2 weeks old can be as useless as one of 2 years. If, as the nights draw in, our most vulnerable relatives are not to return to darkness, ministers will have to find a way to make the routine testing they've promised more than Whitehall words, and instead a reality where it matters.